Hello, this is Jim, and I'd also like to introduce Angie and Gaius. We are Outpatient Service Global Inc., and today we are going to speak with you about our laboratory.
Hello all, my name is Angie Betancourt and we are Outpatient Service Global Incorporated. We are located at 990 Fictitious Street, Lala Place, TM, zip code 0001, and we are an outpatient laboratory that is designed to help the community.
Everybody, scope of service. We provide a competitive waived and non-waived laboratory testing that encompasses a variety of diseases with more focus on drug testing. We are dedicated to outpatient services for initial diagnosis and follow-up cases. We provide a comprehensive testing within our remarkable departments in hematology, chemistry, immunology and serology, and microbiology. Our staffs are among the best in the business, each having at least 5 years of professional clinical experience, including a master's in their profession.
Our mission statement, it is to be the leading outpatient rehabilitation testing center in the community. Our dedication is to aid physicians and their patients reach a treatment plan that will shorten rehabilitation time by providing laboratory results in a timely manner while adhering to strict ethical codes of conduct. We also strive to help raise a healthy community by providing rapid STD screening results in order to promote health in all aspects of a patient's lifestyle.
Vision statement. Our vision at Outpatient Service Global, Inc. is to provide a stress-free environment where physicians and patients alike can obtain quick and reliable test results that will help them decide on the path to a successful rehabilitation. We will want to lessen the burden on those who reach out for help and give them the peace of mind that would come with fast and accurate results. By performing community outreach through partnerships with local clinics, we would aim to create an environment where fear does not preclude patients from seeking help.
When it came time to choose the regulatory agency, it was a pretty easy decision. As you know, under CLIA, we had to maintain accreditation under one of CMS selected regulatory agencies, and we chose CAP. The College of American Pathologists is one that's familiar with most laboratorians, and we were all familiar with their inspection and proficiency testing processes. It made it a good fit for us to use to stick with what we know.
At Outpatient Service Incorporated, we perform testing of different complexity levels, such as wave testing that includes our dipstick or tablet reagent urinalysis, and it also includes our point of care rapid testing, such as the HIV antibody test and the syphilis health check that is performed for the community. Our provider performed microscopy testing, which includes the wet mounts that we also perform from the community, includes the preparations for vaginal, cervical, or skin specimens, as well as the non-waved testing that includes the testing performed in our bigger laboratory departments in microbiology, immunology, serology, hematology, and chemistry.
The different test menus that we have provided for our organization. We see the different departments here: microbiology, immunology and serology, chemistry, and hematology. Just to name a few, we could see the different tests, such as anaerobic culture of bacteria for microbiology, rapid strep group for immunology and serology, renal function panel for chemistry, and sedimentation rates for hematology.
Much of our testing is done manually, but we decided for the majority of the panels and routine type testing, we would need some analyzers just to make the workflow go easier. Our choices for these were the Siemens Dimension EXL. For chemistry panels, it's a pretty solid device, good support. It was an easy choice for that. We chose the Sysmex XP300 hematology analyzer in order to do our CBCs and other moderate complexity with the whole blood analysis. And our final analyzer that we use is the Abbott CP3000 for our coag testing.
Since we are a rather small laboratory, which the bulk of our testing consists of sendouts and a small number of outpatient um, patients that come in for STD testing, we only have one lab director, Mr. Bob Ross, with a PhD as a requirement. We only have one lab manager, Maggie Smith, with a master's degree as a requirement, MLS ASCP. And then after that, we have our departmental team leads. Our hematology lead is Dave Justice with a bachelor's as a requirement, MLS ASCP. Our chemistry team lead is Denise Richards with a bachelor's as well. Our micro team lead is Marco Polo with a bachelor's. And our immunology serology team lead is Betty Davis with a bachelor's. We do not have blood bank in our laboratory. So we also have two afternoon techs that come in the afternoon. Howie Mendel with a bachelor's and Joanne Rivers with a bachelor's. We are open Monday through Friday from 6 a.m. to 6 p.m. So we have 12-hour shifts. And the primary techs, which are the departmental lead techs, they cover like during the day and do the testing, and the afternoon techs act as coverage until closing at 6 p.m. And since we are a small laboratory, we also perform phlebotomy for patients that do come in for that community outreach STD testing that we perform. And that's it.
Proficiency testing. Outpatient Service Global subscribes to the CAP Proficiency Testing Survey Program, matching the analytes and complexity of the laboratory. The survey may include both regulated and non-regulated analytes. However, CAP does not provide PT for all tests. Procedure for PT using CAP survey material include the receipt of CAP survey material and distribution to the service, processing of specimens and reporting results, reviewing CAP survey results, cease patient testing if and or when to repeat PT failures, and record all PT testing and performances and corrective actions in a safe, reliable location.
The continuing education of our staff is very important to us. We are highly dedicated to continual learning, and we want the same from our employees. As a result of this, our policies allow for maximum participation, workflow allowing, of course. And the main goal is to make sure that no matter what changes come up in the industry, our techs and ourselves are able to keep up with the times.
Okay, so as we all know, as per CMS, competency assessment is used to confirm that laboratory personnel are adequately performing their laboratory duties. The competency assessment is performed by personnel that meet the regulatory requirements. In this case, are departmental leads. And the competency assessment, as per CMS, it is performed semi-annually the first year, so every 6 months, and then yearly or annually after that. The assessment needs to be done for every department, of course, and they are distributed throughout the year so to minimize the impact on the workload and not overwhelm our employees. The form that we are using in our laboratory is based on career banding, and it is a compensation management and position classification system first introduced by North Carolina's Office of State Human Resources in 2004. So as you can see here in under position requirements, where we have levels, contributing, journey, and advance. So those are the 3 competency levels. The contributing competency represents a position that requires entry-level competencies to perform the work in that role. The journey competency level means a position that requires mid-level competencies to perform the work in that role, and the advanced level represents a position that requires the highest level of competencies to perform the work of that role. And also it would mean that you grasp the knowledge and would be able to teach others as well. As per CMS, while performing a competency assessment, we directly observe test performance that includes patient preparation, specimen labeling and handling, processing, and the actual testing. We monitor the recording and reporting of test results. We also review worksheets, QC records, proficiency testing results, and preventative maintenance records. We directly observe the performance of instrument maintenance and function checks. And to perform the proficiency testing, we use previously analyzed samples that already have a result. And we also assess the problem-solving skills of the technologists.
Outpatient Service Global have placed the necessary policies on work-related injury and/or illness, accident prevention, personal protection equipment, latex sensitivity and/or allergy, blood-borne pathogen exposure, blood spill cleanup process, chemical hygiene, electrical equipment safety, fire prevention and control, and medical waste management, all according to OSHA safety standards. Laboratory safety manuals have been created in order to ensure understanding of these rules and regulations for all personnel. Each employee is required to read through the safety manual, then print, sign, and date the appropriate form.
Our event management policy is kind of a catch-all for anything that could potentially go wrong in the laboratory. We have our policies in place to handle these situations, whether it's internal to the lab or external. Like I said, these could be documentation, results, improper diagnosis, even customer satisfaction issues can all be considered under the event management policy. In order to make sure everything gets put to right, we have corrective and preventative plans that lay out the steps to take to make sure that we take care of the problem and monitor it to make sure this kind of thing doesn't happen again, if it's avoidable, if not just to minimize it happening in the future.
Center LIS. Center Laboratory Information System is what we're going to be using for our organization. Center promotes innovation of healthcare. Center is user-friendly. Center can be easily maneuvered by technologists. It works with other prominent computer systems in the laboratory. It provides auto-verification, and it eases the stress of healthcare.
Continuing with the procedure manual and quality control, we talk about briefly about the QC that is performed, which is the external QC that is provided with the kit, and that is mostly performed during lot-to-lot validations, like when we receive new shipments of the lots. In patient testing, we of course provide a step-by-step procedure guide that is taken from the package insert, and in interpretation we provide a visual guide that is also provided from the package insert, as well as a verbal explanation of what you will see with the results, as it is a visual colorimetric change. So in the last sections of our procedure manual, we covered the limitations, which include possible interferences to the test. This could include, for C. diff testing, the temperature, which at room temperature, toxins A and B have shown to degrade rapidly, as well as pediatric specimens aren't well tested. They aren't well approved with this kit, so it shouldn't be used for pediatric specimens. The documentation of patient results goes into how to result in Cerner, and in references we mentioned we give credit to the literature that was used to write the SOP.
And now we come to the end. On behalf of myself and the rest of Outpatient Service Global, I'd like to thank you for taking the time to view this presentation. And of course, we wanted to end on, I guess, the most important note involving our lab, the most important document, which is our Certificate of Accreditation according to CLIA from the Centers for Medicare Services. This is the bread and butter of any lab. Without it, there is no patient testing, there's no patient care, and there's no Outpatient Service Global. So this is the cornerstone of our entire lab. Thank you for taking the time to see our presentation, and have a good day.